Hi, today we would like to present about our group assignment. First of all, let me introduce our group member, which are Aina Mardia, Mohammed Suddin, Arif Firdaus and Mbak Khalid. We will present based on our assignment, which is organizational behavior on personality, values and perception.
Hi, my name is Mohammed Suddin and I will continue with our next presentation. We will explain and describe the job holder for a doctor in this video. A doctor is responsible for all sides of care of a patient. They diagnose, educate and treat patients to ensure that they have the best possible care. A few of the main duties of a doctor are performing diagnostic tests, recommending specialists for patients, documenting patients' medical history, and educating patients. They also must administer vaccines and other treatments. Some of the jobs titles that a doctor could grow into are head of research or hospital president. A doctor should have at least 4 years experience in residency as well as a doctorate degree from an accredited medical school. One of the most important skills that a doctor will have been their ability to diagnose their patients. Another skills is empathy, as a doctor will need to relate to their patients. They also need to be able to multitask by working with several different patients. There are two big 5 model of personality traits that we think would have the most impact on the job holders. Emotional stability, neuroticism. People with positive emotional stability are calm, have high self-confidence, and secure. For example, doctor need to stay calm when there is any situation that is important situation and can threatening the life of the patient. They also need to focus when doing their job. When there is a patient in critical conditions, they need to stay calm and focus to solve the situation. Every decision that they make should be confident with what they choose, because their decision might affect the outcome of the situation. High risk-taking people to make quicker decisions, use less information to make decisions. However, a lot of peoples are moderate risk takers because they always do a proper planning before making any decisions. Doctors need to have the courage to make high-risk decisions because they will always be in critical situation. If the doctor does not have the courage to make high-risk decision, they do not qualify to be a doctor. Self-esteem is individuals' degree of liking or disliking themselves. Those with high self-esteem have more self-confidence in comparison to those with low self-esteem. Doctor need to have high self-esteem because their responsibility is big that they need to take decision. Their decision will determine the life or death of their patient. So, doctors has to have self-esteem and confidence. Next is self-monitoring. It is a personality trait that measures an individual's ability to adjust his or her behavior to external, situation factors. This type of individual will behave differently based on needed requirements of the environments. Doctors will face a lot of important decision in their life as a doctor, so they have to understand the situation and make the right decision so that it all ends safely. Hi, I am Mbak and I will continue with our presentation on this video. Next is 2 relevant values that the job holder possesses based on this position. There are 2 types of values in our life. The first one is terminal values. It is the goals or objectives that a person would like to achieve during his or her lifetime. Terminal values are desirable end states of existence. The second type is instrumental values, which are preferable modes of behavior. It is the means or ways of achieving one's terminal values. A doctor carries a big responsibility in their career. They have been chosen to make sure that the health of people is being taken care of. They also need to make sure that they can be reliable to others in need because other people will always look at them for medical assistance. Courage. The term frequently used in medicine is moral courage. Moral courage can be defined as the voluntary willingness to stand up for and act on one's ethical belief despite barriers that may inhibit the ability to proceed toward right action. A doctor needs a courage and confidence, especially when doing a serious task like a surgery.
Hi, I am Ina Mardia and I will continue our last presentation for this video. Hofstede dimensions. Collectivism. The collective dimensions consider the degree to which societies are integrated into groups and their perceived obligations and dependence on groups. In medical career, doctors will always rely on other doctors whenever they need any assistance in certain aspects that they might not have the skills or specialty. Avoidance index. The uncertainty avoidance index considers the extent to which uncertainty and ambiguity are tolerated. This dimension considers how unknown situations and unexpected events are dealt with. A high uncertainty avoidance index indicates a low tolerance for uncertainty, ambiguity, and risk-taking. The unknown minimized through strict rules and regulations. Therefore, as a doctor, an uncertainty is not an option because their profession are including people's lives, thus making them to have a low tolerance for uncertainty. Having a career like a doctor might have distinctiveness in the attribution theory. Distinctiveness refers to how unique the behavior is to particular situations. There is a low distinctiveness if an individual behaves similarly in all situations, and there exists a high distinctiveness when the person only shows the behavior in particular situations. If the distinctiveness is high, one will attribute this behavior more to the circumstance instead or person. For example, referring to a situation where a doctor is complimenting a nurse's work, if the doctor almost never compliments other people's work, he shows high distinctiveness. But if he compliments everybody's work, this is low distinctiveness, and one will attribute the behavior to the person, in case the doctor. Thank you for watching our video.